views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Hello and welcome to Open BXRx, BronxNet special coverage providing you the latest information, resources, services, and community efforts taking place locally here in the Bronx and virtually throughout the pandemic. I'm your host, Sonyi Lopez, and today is Tuesday, October 27th. Coming up, flu season is upon us and COVID-19 hasn't quite left us yet. A Montefiore doctor joins us to answer questions like what are the differences in symptoms and how does the flu spread differently than COVID-19 and more. Then we'll discuss how you can tour the Bronx virtually this year on your bike with the Bronx Tourism Council. After that, a Mott Haven Families organizers joins us to discuss how residents in the South Bronx are supporting their community through activism, mutual aid, and organized family-friendly events. And we'll learn about Dikeman Farmhouse and their safe reopening with a new art exhibit exploring the untold history of New York City's Black communities. So please stick around. Open BXRx starts now. Flu season is upon us and COVID-19 hasn't quite left us yet. Many people who become ill may be unsure whether they have the flu or COVID-19. What are the different symptoms and how do they each spread? Joining us now to address all of your concerns is Dr. Margaret Aldrich of Montefiore Medical Center. Dr. Aldrich, thank you so much for making the time to speak to us.
Thank you. Thank you for having me, and I'm glad to speak with the audience.
Of course. A very important topic this season, right? The flu season is upon us. Doctor, can we discuss this year's flu season during coronavirus and how are doctors preparing differently this year?
So I think at this point in the flu season, we're still a little bit on the early side. Flu season can go from October all the way to April, really. So we are really focused right now on prevention. That's, I think, across the city, you're going to be seeing doctors and healthcare providers and systems really trying to get people out there and get their vaccine because, as everyone knows, we do not have a COVID vaccine yet, but we do have a flu vaccine. So that's a really good way for people to take control of their health and their children's health and to really focus on the prevention side of it right now.
Right. And doctor, what are the main differences and symptoms between the flu and COVID-19?
So a great question, because as I'm sure a lot of your viewers know, there are some overlapping symptoms between flu and COVID. You get the body aches, you get the fever, you can have sore throat and cough. The difference really is that COVID has all these other crazy signs and symptoms that don't usually go with flu. So, anything from losing your sense of smell and taste to blood clots to strange rashes on your fingers or toes. These are things that we really don't see with influenza, but we do see with COVID. And that's one of the major differentiating factors is just those weirder signs and symptoms that are more suggestive of COVID as opposed to flu.
Right. And how about the spread, doctor? How do they spread differently, the flu and COVID-19?
Right. So a lot of your viewers might have been hearing about this in the news lately. People have been talking about airborne transmission versus droplet transmission. So in my line of work, we do a lot of education for healthcare providers and for the public to try to understand what's the difference between these. So something like the flu can really be spread mostly by droplets. So that's like, you're not going to be able to spread it more than 6 feet because you cough, you sneeze, those respiratory droplets, they come out of your mouth or your nose and they're going to fall on the ground within a few feet, okay? Airborne is you cough or sneeze and those droplets are really, really tiny and they go up into the air and they get carried farther. So you might actually expose somebody who's 13 feet away from you. I think the take-home message here is really to remember the way to prevent these viruses from spreading, both influenza and COVID, is wash your hands, wear your mask, stay 6 feet from other people, especially if you can't wear a mask. Thank you. I love the design. And stay home if you're sick. That's really important. It used to be people would be like, I've got a little fever. I'm going to push through, take some Tylenol. I'm going to go to work. I'm going to send my kid to school. Can't do that this year. Please, please, please do not do that, because we don't know if that's COVID. We don't know if it's flu, and it really could be deadly to another person.
Absolutely. Thank you, doctor, for the pointers and the reminder also to wear our masks during this season. Is it possible to have both COVID-19 and the flu at the same time?
So there have been reports of people getting, potentially having co-infection. We do not have any documented co-infection, COVID and influenza, as of now, but we do worry that that is a possibility. And we worry particularly for people who might be medically fragile, so elderly, very young children, people with diabetes, people with sickle cell disease, people who have cancer, who might not have an immune system that is really able to fight off both infections, and potentially they could be exposed to both and have a co-infection. COVID's bad enough, but COVID and flu together, we really worry that those people are going to become extremely ill. We think it's going to be rare, and we really hope that everyone in the Bronx gets their flu vaccine, which means it'll be really rare in our community. But we do worry that it's possible to have a co-infection with both SARS-CoV-2, the virus that causes COVID, and influenza.
Let's discuss the benefits of the flu vaccine, doctor. You just brought it up, and why the flu shot is more important than ever this year. Just an emphasis on getting this vaccine this year.
Yeah, so luckily, we have a few things that we can use to prevent and to treat influenza. So the vaccine, pretty much every year, vaccine is available, and it's tested. Millions of people around the world have gotten this vaccine before it ever even comes to New York City. So people in Australia, South Africa, Chile, all around the world have probably already gotten this vaccine. So we have the benefit of safety. We know this is safe because so many people have already gotten this vaccine this year and in years past. It's got years and years of testing to show that this is actually very safe. Now, the other thing is with flu, we can also give a medicine if you get the flu and treat it. This is different from COVID. And so what we're really asking is people to realize that you can take control of your health by getting your vaccine. That is a way that you are going to be able to protect yourself, your children, the older people in your community, the people who might have medical conditions. It's essentially, I think of it as your service to your community is to get your vaccine. That way you cut the spread of influenza in the community. This is more important this year than maybe any other year in the past decade, because we have another respiratory virus, COVID, circulating still in our community, and that is not preventable at this time. We don't have a vaccine for it, and we really rely on people doing things like masking, hand hygiene, keeping distant from others. And that is, that's the only thing we have for COVID. Flu, we actually have this vaccine. And we worry a little bit about people using the healthcare system, when we need our healthcare system to be available for COVID patients with influenza. It's something that we can actually prevent.
Yes, absolutely. Doctor, let's say we have a viewer tuning in who says or thinks that getting the flu shot actually gives them the flu. Is this a myth? And should people be concerned about a weakened immune system from this shot during this season?
This is a great question. So I actually get this every year from my patients. I have many patients who tell me, Doc, I don't get the flu shot because it gives me the flu. And what I can say is, I hear you, because it's certainly true that some people, when they get the vaccine, they do feel a little sore. They might feel a little bit like they have a little achiness in a day or two after their vaccine. They might even run a low fever, 100, 100.1, something like that, and feel a little bit like, wow, I feel flu-like. The thing is that is actually your body's immune system responding to the vaccine and building itself up so that when you do get exposed to the actual flu virus, your body is ready and it knows how to fight that. That is different than actually having the infection. The vaccine that most people get is the injection, and that vaccine does not have any actual virus in it. You're not actually getting a shot of infection. It is modified so that it tricks your body into thinking that you had the flu, and it prepares your body so that when you are exposed to the actual infection, your body really knows how to fight it. So yes, you might feel a little bit off for a day or two. You did not get the flu. Some people do get vaccinated and a week or two goes by and they actually get the flu because their body hasn't had enough time. It takes about 2 weeks for your body to build up its immunity once you get the vaccine. So it is possible you get the vaccine on Monday and then you're at work on Friday and your friend has the flu and you get the flu. It's not that the vaccine didn't work. It's that your body didn't have enough time yet to build up its immune system against that exposure.
Got it. Thank you, doctor, for clearing that up and helping us understand that during this scary season in our life. Before we go, where and how can people get a flu shot safely this season?
This is really important information to share. So many people probably realize their local pharmacies often have the vaccine. That's a great way, easy way to do. You could do walk-in. Montefiore Medical Center has some mobile sort of flu clinics that are run in various parts of the Bronx, and I think we can share that information with your viewers. In addition to your own primary care, if you have a primary care provider, a pediatrician for your children, or your own primary care provider, really all clinics in New York will be stocked with influenza vaccine. There's a real big push from our health department also to make sure that people all over the city have access, including, I think, some Department of Health clinics that might be offering influenza vaccine for free.
Thank you, Dr. Margaret Aldrich from Montefiore Health Center, for joining us today.
Thank you.
Again, folks, you heard it, Bronx. Continue to protect yourself from the coronavirus and the flu this season by wearing your mask and going out to get the flu shot. We'll be right back.
A gun buyback program is coming to the Bronx on Saturday from 10 a.m. to 4 p.m. here at St. Luke's Episcopal Church, located at 777 East 222nd Street. District Attorney Darcel Clark, who teamed up with elected leaders, including New York City Council member Vanessa Gibson over the summer for anti-violence forums and marches, is partnering with the NYPD and the Yankee organization to announce the public can turn in an operable gun, no questions asked, and receive a $200 cash card. In addition to this, the first 75 will receive an iPad from her office. The Yankee organization is also donating an additional 75 iPads to be given out on a first-come, first-served basis. This comes as shootings are up citywide this year compared to last year. In the Bronx, there have been 315 shootings so far, wounding 377 people, a major jump from 2019 when there were 176 shootings, wounding 196 people, along with the 200 for guns that can come from all neighboring counties, including Westchester. People who turn in rifles, shotguns, or air guns will receive $25. For more information, go to bronxda.nyc.gov. For BronxNet, this is Arlene Makoko.
Every year since 1994, over 10,000 participants get the opportunity to tour the Bronx, promoting a healthier lifestyle, an alternate mode of transportation, and a way to tour the burgeoning neighborhoods, scenic waterfronts, and greenways of our borough on their bikes. This year's tour is a little different with a virtual element and social distancing measures. Here to tell us more is Olga Tirado, Executive Director of the Bronx Tourism Council. Olga, thank you so much for joining us today.
Thank you for having me.
Of course. For those who are not familiar and tuning in, please tell us a little bit more about the Bronx Tourism Council before we start.
Well, the Bronx Tourism Council was actually created in the early 1990s, and it was a way to, I think, for the borough president at that time, which I believe was Freddie Ferrer, to have an institution that was a division of the Bronx Overall Economic Development Corporation, to help put together events and create opportunities, to create messaging and branding opportunities and marketing opportunities. I took over the agency in 2012, and because Borough President Ruben Diaz Jr. then created his own special events team, that team did all of his heritage events, and we continued to do some of the more borough-wide, what we call signature events, such as Bronx Week and Restaurant Week and Tour de Bronx and other initiatives that we created ourselves, and also tours that we did.
Gracias, Olga. And I'm sure the work has changed over at the Bronx Tourism Council during COVID-19. Can you tell us how the pandemic has kind of changed and shifted that work for you?
Well, I mean, one of the great things about our team, and also many people from the Bronx Borough President's Office, is that there has been no shortage of creativity. So a lot of things have shifted for a lot of people, but we've been able to, at the very least, kind of pivot and provide virtual experiences for people. We also do a lot of work with our cultural partners, such as the Bronx Zoo and the Botanical Garden and such, and some of the smaller institutions like Spregones Theater and Casita Maria, and Wave Hill, and we've been able to kind of work together with them in creating opportunities for people to still continue to experience what the Bronx has to offer, but from a safe distance until such time that we're able to get back out there.
Right. And one of those virtual experiences this year's Virtual Tour de Bronx. Tell us a little bit more about the event, Olga, and the routes that people can take, as well as the themes.
Well, it's sort of a combination of virtual and actual, the Tour de Bronx. So you can go on, and through the help of BronxNet, between our partnership, we have been able to create a video that kind of shows you part of the Bronx from a cyclist perspective, a cyclist point of view. But we also have created an actual Tour de Bronx. Normally, we would have this one-day event where we would have 10,000. We've had up to 10,000 cyclists come together at one day and at one time, and everybody gets started together, and you'd have, all these thousands and thousands of people riding at the same time. Well, we can't have that. This year, unfortunately, all of those plans for those big events have changed. So what we decided to do was sort of get the same amount of people if we can, but sort of spread it out, right? So we've created these 3 different routes with the help of transportation alternatives, and also our partner Ride with GPS. And the 3 one is called the 8 Wonders of the Bronx. Another is called Boogie Up the Bronx River Junior, because Transportation Alternatives has a bigger ride called Boogie Up the Bronx River. And then the other one is called the Bronx Riviera. And these 3 different routes are 3 different distances and take you to 3 different locations throughout the borough. The 8 Wonders of the Bronx is about 44 miles. It's the longest one and the most challenging one. Boogie Up the Bronx River is 15 miles, and the Bronx Riviera is 20 miles. So you can choose one or do all of them, but at your own pace, on your own time, and with your own group. So, because we can't get 10,000 people together, we figured, well, at the very least, we're going to give you an experience so that you can see parts of the borough. Now, the partnership with Ride with GPS, normally that would be an app that you would pay for, but the Bronx Tourism Council has a club account. you can join our club account for free. And you can have access to all of those routes. They will give you, you can see the route right on your phone as you're riding. We have a couple of points of interest that come up. So if you're passing one of our tourism points of interest, it'll come up on your phone and tell you on your right is, I don't know, the Edgar Allan Poe Cottage. And we'll give you a little bit of a background about the Edgar Allan Poe Cottage. And the great thing about that is you can just, you could take it slow. The other thing is we also were able to partner with Link NYC. Link NYC are those kiosks that you see throughout the borough.
Right.
You can charge your phone at a Link NYC kiosk. And so they've provided us the opportunity to let people, because sometimes these apps do take up a lot of battery, but you can charge your phone at any Link NYC kiosk. The other thing that we have is that we've partnered with some of the restaurants and a couple of retailers that if you download the bib and you show them your bib, you can get certain discounts on food or on merchandise. And we're trying to bring everybody together, businesses, small businesses, our large institutions, our riders, and at the very least give them an opportunity to enjoy the borough in a way that we can't together in that large format. And hopefully that'll change and we'll come back to all being together in one place at one time. But for now, this is the way, this is the safest way for us to do this.
Sounds like a beautiful event that people can participate in a socially distanced manner. It's a little bit for everyone, cyclists and beginners alike, people that don't have the experience with riding bikes as well. So it sounds wonderful. Thank you for sharing, Olga.
Hey, you know what? I just thought of something. You can walk the route too.
Wow.
And still get, so if you want to get together with a bunch of people and walk it, you can walk the route. I'm sure the 44-mile one may be a bit challenging, but some of the smaller routes might just, work out for you.
And at the end of the day, it's to promote a healthier lifestyle in the Bronx. So, anything goes in the Tour de Bronx. Olga, how can people participate? What are the apps, the names of the apps so they can download it now if they're interested in participating?
Right. Well, you can go on to ilovethebronx.com and go on to the Tour de Bronx page. And right there, it will give you a listing of the different routes and the links that you can then download the app or join our club account free of charge. So you don't have to pay for the Ride with GPS app. There's a waiver that you have to kind of read and make sure, understand that this is not like Tour de Bronx of the past. It's not guided. We don't have NYPD, stopping traffic for you. So please be mindful of the rules of the road. Please be mindful. Please wear a helmet because, that may save your life. And just be careful. Make sure that, as you're riding, and also be mindful that you're riding the route that coincides with your level, because you don't want to start riding all the way out to Orchard Beach and then find I'm stranded, I can't ride anymore. So please be mindful of your skill set as well, and just make sure that your bike is in good shape for riding.
Absolutely.
Yeah.
Great point. And Olga, on another note, you've also been working on something exciting for podcast lovers. Can you share a little bit more about the Go Bronx Pod?
So, again, in thinking of opportunities to if you can't go out and see the Bronx, to bring the Bronx to you, we've decided that we would do that with the podcast. So the Go Bronx Pod is a weekly pod. We have a new episode every week. Tomorrow we're going to launch episode 9, and it's going to be called Bronx Monuments. We're going to be talking about some of these sculptures, statues, and monuments that are in the Bronx and the history behind them. The great thing about podcasts is that you can binge listen. So if you missed last week's episode, that's okay. You can listen to episode 1, which when we launched in August 26th, we're now on episode 9. So we decided to bring some of the history and some compelling moments to people that you can. I'm a pod listener, so I for me that's great. So for me it's as I'm doing the dishes or going for a walk or riding a bike or working on something that I don't really have to pay that much attention to, so that I can listen as I'm doing whatever it is that I'm doing. So I happen to be a pretty huge pod user. So that's what it is, and you can get it. You can actually, if you want to listen to our episodes, you can just go onto our website. Again, ilovethebronx.com, or we have our landing page is gobronxpod.com, and all of the episodes are on our landing page. But if you do happen to be a pod person and you listen to pods, you probably do so on your Apple Podcast or Stitcher or Spotify or iHeartRadio. It's available on any one of those platforms as well.
That's Go Bronx Pod. So you can visit I Love the Bronx to find out more about that podcast.
That's right.
Olga, before we go, can you please leave us with a message on supporting local businesses in the Bronx before,
Yeah, our businesses are suffering, where they normally would have lines around the block. They can't do that anymore. I would say that, if you want to buy a pair of sneakers, please go to, a local store. If you want to, if you're hungry, please go to your local restaurant. Let's help our businesses recover from a pretty drastic and a pretty terrible first 8 months of the year. That's for sure. So, I would suggest definitely. I support as many businesses as possible.
Whether it be in person, Uber Eats, whatever you can do to support our local businesses, please do that. Don't forget that they also need our help and our support during these times. Thank you, Olga, again for your time today.
Thank you for having me.
Get your bikes out and tour the Bronx between now and November 8th and find out more about the Go Bronx Pod by visiting ilovethebronx.com. We'll be right back.
We know that people are dealing with the health crisis, but there's also a lot of food insecurity.
We're giving out healthy food options, and that's what's key here.
If you're a senior, you have a disability, they'll actually deliver meals to you.
The residents are anxious, they're worried, they're scared, they want to be tested.
When things were happening in our community and we couldn't get the help.
There's almost a presumption of criminality that attaches to your skin color.
The site will prioritize those who are at highest risk in the population.
If you feel symptoms and you'd like to visit one of these COVID-19 testing sites here in the Bronx, you may call the State Health Department's hotline.
Important to note about this site is no reservations are needed. This is a walk-in clinic.
A lot of us are out of work and looking for something to do.
We have the machinery and the skills to make large scales of these masks and gowns.
Take care of your people. It's going to go way further than we actually can understand.
Right now, employees like myself are just adjusting to the new reality.
Reporting from BronxNet, this is Margaret. Listen up, Bronxites. Election Day is Tuesday, November 3rd. Are you safely hitting the polls for in-person voting? Or are you voting absentee by mailing in your ballot? New York offers absentee ballots by mail to voters who will be unable to vote in person for any reason. Absentee voting can be confusing, but it's safe and has become more common during coronavirus due to fears of crowding when voting at poll sites. In the primary elections, more than 500,000 ballots were rejected and discarded due to human error. So before you start filling in your ballot, make sure to keep the following in mind. Fill in your bubble selections with a blue or black ink pen only. Never mark any X's or check marks as opposed to filling these bubbles in. Don't forget to sign and date the back of the ballot envelope. And finally, mail your absentee ballot before the deadline November 3rd. You can also drop it off in person at an early voting poll site between October 24th and November 1st, at a poll site on Election Day, November 3rd by 9 p.m., or at the Bronx County Board of Elections office no later than November 3rd by 9 p.m. Stay informed, stay safe, and most importantly, make sure you mail your absentee ballot or wear a mask, remain 6 feet apart, and safely head out to the polls to have your vote count and your voice heard.
most at risk for coronavirus? People over 65, people with underlying medical conditions like heart disease, chronic lung disease, asthma, diabetes, people undergoing cancer treatment, and people with weakened immune systems. What should you do if you or a loved one is at higher risk? Avoid close contact with people, avoid crowds, stay home if you can, wash your hands frequently, learn more ways to protect yourself and others at coronavirus.gov.
Welcome back. Since June, Mott Haven families have come together on the corner of 138th Street and Alexander Avenue every Sunday morning to advocate for Black lives and voice their collective concerns through activism, mutual aid, and family-friendly events. Joining us now to share more is Jason Epting, an organizer at Mott Haven Families. Jason, thank you so much for joining us today.
Hey, thank you for having me here. I really appreciate it.
Of course. I gave a little bit of a background on Mott Haven Families, but can you tell us a little more about the initiative and your Sunday morning events for those who are not familiar?
Absolutely. We are a collection of families. We're a diverse group of people that live in the Mott Haven area. We just really believe in family. We believe in the best for our community. We want the best for our children, but the best for everybody's children and their families. And so we got together over the course of time, trying to find ways to connect, and we just came together and we focus on joy and creativity and just trying to do the best we can and be neighbors to the people around us. Our idea is that we want to partner with other organizations who've been doing great work, but also start some other work to make sure we're advocating for our communities, and that might be in education, healthcare. It could just be like having opportunities for us just to have fun and get to know each other. We wanted to do all those different things. It just so happens that the Sunday events came about after the protest that came after the George Floyd death. There are protests all over the country, as you know, but we were very proud that there were protests in the South Bronx, and there was protests here. And based on what happened on June 4th, where the protest came to the South Bronx and came down 136th Street, we were just mortified by the actions of the NYPD, and we just felt like we just had to do something for our sake, for our kids' sake, and for our neighbors' sake, that we won't just take this laying down.
Thank you, Jason, for the background. On the same stream of the protest that happened during June 4th, can we discuss the current state of affairs between the Mott Haven community and the police at the 40th Precinct in particular, especially after, like you said, peaceful protests took a violent turn on June 4th in the community?
Right. So first of all, I'll just tell you quickly what happened June 4th. June 4th, as we were standing outside, we actually had the opportunity to witness what happened. There were peaceful protesters that were walking through, they're chanting. We didn't see anybody being a ruckus or anything like that, but as they're walking down the street, we noticed that there was, after they walked by at around 7:40-ish, after they walked by, we saw twice as many police officers come behind them, and all of them from different kind of uniforms, meaning that they're from different departments all over the New York City. You can tell they look militarized. They had bikes. They just look like they're ready for war. At the end of that block, they kettled them, which means that they just corralled them, and there wasn't an opportunity for them to move. And at the end of that, at the time that 8 o'clock came around, Mayor de Blasio's curfew went into effect, and that's when I would say chaos break loose, where officers were hitting people with batons, standing on top of cars, hitting people with batons. They actually assaulted a few nurses. I saw that there were doctors being arrested, legal observers being arrested, people who were supposed to be there were pulled out, and then it seemed like the violence all came from NYPD. And just being a witness to that and just knowing that that happened in my community and the community that we're trying to build to be a safe and happy place, it just was horrendous for us to see that. So since then, we've had a protest for the last 4 months, just needing and asking for accountability, asking for transparency about what happened those days. We've seen a few things in the news, but we just haven't gotten enough to get our demands met. So we meet in a family-friendly way every Sunday, where we're having our kids and ourselves protest these, brutalizing protesters from the people that we trust the most. So it's been a great run for us because we've built community through it, but we shouldn't have to come together on these terms for somebody we want to make community with as well.
Right. And Jason, this past Sunday has been a little different for my Haven families because, as we know, there was a recent Blue Lives Matter rally that took place on the same corner that you usually get together on, no?
Yeah.
Can you tell us a little bit about what occurred and, you know, about the counter protest that you held there that day?
Well, we didn't feel that we were not going to stand for a Blue Lives Matter rally with their racist rhetoric of Blue Lives Mattering and those things coming into our borough. Even if June 4th never happened, that was something that we're going to make sure that we stand up with our neighbors and making sure that those kind of things cannot happen in the neighborhood that we reside, especially considering all the disparities that happened with the South Bronx and the Mott Haven area. What actually happened that day was it seemed like there was a rally that was supposed to happen where they were going to talk about unity between the clergy, unity between the police, and then unity with the community. But what I saw missing was there's only like maybe 10 people there, and it felt like it was like the speakers and a few organizers. They were missing the key component, which is community. And actually on our side, where we're counter protesting, that's where the community was. And it didn't seem like they're trying to engage with us in a way that they want to build community. It was more or less like patting police officers on the back for doing a good job, when really, you know, I just think with patriotism, the best thing to do is, if you are going to be about your police department or your country and those things, you really have to look at what things are great and then also look at the things that aren't going so well and look at ways to be efficacious in making them better. So we had probably about 60 people. They had about 10 to 12 people, and they had speakers. It was very peaceful. We set the tone very well, but there are reasonably people who are angry, who are talking to some people who are engaging with some of our people. But we felt like we made a stance of like, we are definitely not just going to allow you to come here and just say, hey, we're doing a great job, when you are leaving open wounds with June 4th happening. And on that too, it's not just June 4th that we're talking about. When the CCRB, which is the Civilian Complaint Review Board, released their data about officer misconduct, the 40th precinct where we reside, they found that there was 100 charges to be substantiated. That means that officers actually engaged in misconduct. And guess who the majority of those victims were? They're blacks, and blacks don't make up the majority of our neighborhood. So we know that there's something to it. We want to look at this through a lens of like, let's just get better. But we are not going to stand for people just changing the rhetoric so that we're following suit with some of the other tricks that are being portrayed right now in the media.
Thank you, Jason. So a lot of unanswered questions, a lot of conversations that didn't exactly happen the way you planned almost with the community there that day, regardless of, you know, the fact that the community was on the flyer for the event. The community didn't feel involved in this said rally, no. Can we also learn about the community's demands moving forward, not only in terms of policing, but in terms of housing, healthcare, and education with Mott Haven families?
Yes. The way that I look at it is like, we want it all. Like, just looking at the decades of marginalization that the South Bronx has encountered, our main purpose was to be in neighborhood with everybody else, but also we want the best for our neighbors. Me being an educator, I want the best schools. I want to make sure the best practices are being executed, that grade level materials are being put in front of every single student so that they can actually make it there and beyond, so they have the opportunity to be on grade level and beyond and be high school graduates and beyond. Healthcare, we want the best of healthcare, and we obviously want to see that less death rates for our women who go into the hospitals, especially to have babies and then they die. I mean, we want everything. We want clean air for our kids and ourselves. We have the highest asthmatic rates in all of New York City, and I would say even the United States. You can quote me on that. But I just think that we want the world and we're going to keep plugging away for anyone who's trying to do these things. So Mott Haven Families wants to mobilize with other organizations who are fighting for these things, and they do that really, really well. But what we want to do well is be sure that our community knows about these different things that we have going on. And lastly, what we demand accountability first and foremost for the people who are involved in it, for whoever pre-planned this response to peaceful protesters or for protesters themselves. We want people who were part of it to to resign or to be fired. We also want we want to reinvest resources into. We want now with these things that are happening to happen all over time. We want actually concrete terms where we can see money being poured into our community. Right now, if you ask the residents, they're like, hey, we don't even have stuff that we had 20 years ago. So 20 years ago, they saying that they even had more, but now all the money is going towards the police and floodlights and uniforms and barricades and those things. Actually, we'd like to see less of that, defund the police in that regard, and give us more money for better schools, better healthcare, to develop the waterfront like you see in other parts of New York City. All those different things are things we want, and we're going to demand them. We're going to keep fighting for them.
Right. And as we know, Mott Haven has been disproportionately affected by the pandemic. So these are all, demands that are equitable. Like, people need these things in the community and should have access to them. Jason, before we go, can you share the importance of activism and community connection in the midst of the pandemic and, all this trauma that we're going through collectively in the community?
Right. The way that I look at the activism, it was definitely a reason. With the pandemic, a lot of us are in the house a lot, and we're like kind of rebuilding ourselves, rebuilding our families. We're getting in touch with who we are. We are being very humble because we can't control what was going on with COVID and what was happening actually in the South Bronx or across the nation for that matter. So at that time, it was a humble time, but also it kind of propels you to make sure that you're doing things for other people. It makes sure that you're doing things for yourself and standing up for the things that actually are right for your environment. And we got to see a clear difference of how things play out in the Bronx and how things played out in other places. And we felt that this was just a reason for us to come together. We're not just going to sit idly by and just hope everything goes well. It was a lifeline for us. It was a lifeline for our mental health. It was a lifeline for us to give of ourselves and give of our gifts so that we can be healthier and know that we're giving an impact to this world. Because I think all of us have changed through. I can speak for myself and I can speak for my Haven's family. Everybody has changed through the pandemic, but also changed with the deaths of George Floyd and changed into the way that we want to become the nation that we want to become. So we started to act those things out. So these activism, now this has propelled us to do this forever, but this was a way to actually push us there, and it was wonderful.
Thank you so much, Jason Epting, organizer at Mott Haven Families, for sharing this today with us.
Yes.
Folks, you can follow Mott Haven Families on social media on Instagram at Mott Haven Families. They meet every Sunday morning between 138th Street and Alexander Avenue at 10 a.m. We'll be right back.
Nike's not the issue. And what do they think of the Bronx? What is Bronx, the low end of the world?
Owner of Frank's Sports Shop, Mo Stein's response when Nike ended their 50-year partnership with his store. The 92-year-old store owner believes this decision could ultimately hurt small businesses like his.
It hurts us reputation-wise. If somebody needs something in a hurry, in a bed, they come right here.
Nike ended their partnership in an email stating in part, "The store no longer aligns with our distribution policy." John Rivera, a customer at Frank's Sports Shop for 60 years, believed Nike's decision is a bad marketing move.
I live 39 miles from here, and I have plenty of sporting goods stores where I'm at, but I'd rather come here. Even though it's a little bit of a challenge with parking, but I always come here because this is where they service me the best.
Since the beginning years of the Yankees baseball team, the vintage store began their partnership with Nike before the brand became recognized worldwide. Now, starting November 23rd, Frank's will become an ex-authorized vendor of Nike goods.
Mo Stein also tells us with all the changes going on, he's just fortunate to be in business.
While repping his favorite team.
My team, number one.
Reporting for BronxNet, Ashley Tiffany.
After a 6-month closure, our neighbors in Inwood at Dikeman Farmhouse recently reopened to the public. They're presenting a new exhibition titled Unspoken Voices, honoring the legacy of Black America. Here to invite us is Meredith Horsford, Executive Director of Dikeman Farmhouse. Welcome. Thank you so much for joining us today, Meredith.
Hi, thanks for having me.
Of course. So for those who are not familiar, can you just tell us a little bit about Dikeman Farmhouse and your mission?
Sure. We are a small historic site that was built in 1784. It is located at the corner of Broadway and 204th Street, which, of course, in 1784 was rural farmland. It was not part of New York City. It was built by the Dikeman family, who came to this country in the 1660s from the Netherlands. And they were farmers. And they ultimately, in 1915, two Dikeman sisters who were descendants of the last Dykemans to live in the museum, in the farmhouse, donated it to the city as a museum. And so we've been open as a museum since 1916. And the mission of the organization is to support the preservation of the historic site, to be a catalyst for engaging, adventuresome programming, and to be a good neighbor and a dynamic resource for our community.
Wow, that is amazing. A farmhouse in Dikeman. Who would have known, right? Who would have thought?
Exactly.
So Meredith, I know things are a little different at the Dikeman Farmhouse, and you've been closed for 6 months, as we said in the introduction, due to COVID-19. How are you ensuring the safety of your visitors now that you are reopened? How are things operating differently?
Sure. So we started out last month in September by just opening the property. So the park and gardens have been open when we're there, so 3 days a week, just to allow people to just get out, get some fresh air, have a change of scenery. And then starting this week, we have been opening the museum itself. We're open 3 days a week, so Tuesdays, Thursdays, and Fridays. And we are taking visitors by appointment only, so that we can ensure that people can really properly socially distance. So when you book, let's say the 10 a.m. time slot, it would be for you and up to 4 additional members of your household, so that it's a household of people that visits, and then a staff member obviously would be there, but that there would just be a lot less interaction that way with other people who are outside of your own bubble. We have also set up hand sanitizer stations throughout the house. We have put away our brochure rack so that people are not touching all of the pamphlets. We've put up QR codes around the house so that people can bring up information on their phone without having to actually touch something. And if there are people who are not comfortable with the QR code technology, then we have a pamphlet that they can have that they can keep.
Safe accessibility for everyone. So that's wonderful to know. Thanks for sharing, Meredith.
Sure.
Can you tell us about your new exhibition, Unspoken Voices, honoring the legacy of Black America? What can people expect at this new exhibit?
Sure. So this is an exhibit that we're really excited about that was funded by the Upper Manhattan Empowerment Zone. So what we did was engage 3 local artists to really create art that was in response to the research that we as an organization are doing on the enslaved history of our site. So we've been really thinking about expanding the narrative of the stories that we tell at the museum, and through a grant from the New York Community Trust, we were able to hire someone to do that research. And now we're bringing in artists to kind of react to that research. So we've got 3 artists, Sheila Prevost, Gwendolyn Black, and Rachel Sidlowski. Each are creating pieces using different mediums, and they're all kind of stationed throughout the museum.
Wow, sounds amazing. Thanks for sharing. How can people view the exhibit? You mentioned the hours earlier and the booking procedures, but just to reiterate again, the hours of operation. So if anyone's listening and is interested in attending, they know what days they can go by.
Absolutely. So right now we are open on Tuesdays, Thursdays, and Fridays, and the time slots that are available are 10 a.m., 11 a.m., and 1 p.m. We want to kind of do this as a test run in terms of being open during COVID and figure out how it goes. And then if needed, we can adjust accordingly.
And what types of conversations does Dikeman Farmhouse hope that this exhibit will bring to focus to the community and, broadly?
Absolutely. One of the questions that I feel like we used to get a lot of is, before we started doing these art installations, is visitors would ask us, did the Dykmans have slaves? How did they operate this massive farm on their own? And then a lot of people, I think, have the misconception that slavery didn't really happen in the North, that New York, that there was no slavery in New York State, that it was really just a construct of the South. And that is not correct. So I think this art is a great way to start a dialogue with visitors. First of all, just, visually, you notice that there's something very contemporary mixed in with these historic pieces. So that's a great starting point right there to talk about this art and what is this and where did it came from and where did it come from and who did it. But also really to have, slavery can be a challenging topic to talk about with visitors. And so I think art is such a great entry point into that conversation, because I think it makes visitors feel a little bit more comfortable to ask questions about the art. And then that can start the dialogue about slavery, that it of course did take place in New York State, that we know that the Dykmans did own slaves. And I think that's a great way for us to talk to people about what we do know about slavery and what we don't know.
Right. Really interesting. I'll have to visit Dikeman Farmhouse
come.
to check out the exhibit myself as well.
It's beautiful.
Meredith, I know that you also have virtual experience for folks who would rather stay home during this time and explore history at home. Can you tell us a little bit about Dikeman at Home?
Sure. So Dikeman at Home is a page that we created on our website almost pretty instantly after we shut down in March, when everything shut down in March. And what we've put on that website is pretty much all of the public programming that we've been doing. We've been creating a lot of virtual content. So we did a summer camp for kids with a bunch of other local uptown organizations. We've done cooking classes. We've done, we just did programs for Open House New York and for New York State Path Through History. We've got, we also created this program called Growing Uptown, in which we've partnered with New York Common Pantry to, they've been delivering seedlings from us so that people can grow their own little crops on their windowsills at home.
I love it.
And be your own urban farmer. So all of these things, page, there's plenty of things for kids and adults to engage with from the comfort of their own home.
Beautiful, beautiful. Thank you. How can people stay connected and find out more about Dikeman Farmhouse?
The most immediate way to find information is definitely social media. We try to post quite a bit, especially on Facebook and Instagram. So please feel free to follow us, like us, all of those things on social media. But then we also do post things on our website, as I mentioned, dikemanfarmhouse.org. Also, if you want to sign up for our mailing list, you can also do that. We send out monthly. We try not to inundate anyone with too many emails. We send out kind of a monthly e-blast about upcoming events. And what's great about them is that it's virtual. A lot of it is virtual. And it's a great way for people to find out about kind of what's going on in Uptown, what we're working on, and kind of what things we have coming up next.
Absolutely. Thank you so much, Meredith, for joining us today to discuss what's happening at the Dikeman Farmhouse.
Thanks for having me.
Of course. Again, folks, if you'd like to visit the Dikeman Farmhouse and see their new exhibition highlighting the history of the enslaved and free Black residents that lived and worked at the farm, please visit dikemanfarmhouse.org to book your safe visit today. That's all for our show today. Thank you for tuning in to BXRx. I'm your host, Sonyi Lopez, wishing you and your family safety and wellness now and always.